And I've actually come across patients, not necessarily patients, but also people like on my TikTok channel asking me about, I'll put videos on the causes of perhaps neuropathy, and they'll ask me about, so what's the solution? And it's difficult because you can't give medical advice online. It's almost illegal and it's just not professional. But even then, there is no one treatment that fits all. But one treatment that came across my mind was a supplement called alpha liponic. So I was reading some papers on that, but the evidence, I'm not going so much into this as a topic, but I'm just giving an example. It was kind of anecdotal. So there's research done, but it's not strong enough. But it suggests that some people who've actually been using it have reported improvements in their neuropathy. But here's the thing, I delved more into it. Obviously, it's not FDA approved, but the FDA actually published some guidelines on it and said that they actually found there was actually some toxins found in some of the suppliers of this supplement. So that's kind of scary because, again, it's not regulated, so therefore they don't need to report what their substances are directly to anyone. They can do anything they want. So that's an interesting aspect where you really need, everything should be FDA regulated, even if it's turmeric powder or a turmeric supplement, because even those can, in high doses, have side effects or interact with other medications.
And that's the moral of the story here, is that, you know, those things theoretically can work, but you want to make sure what you're taking is really what they say it is. And of course, without having FDA approval or any type of oversight, we really don't know what the side effects are. You know, part of the FDA approval process, as we're all learning again with the COVID vaccine, is at first you have to test the medication to see what the side effects are. And you actually go higher than the standardized dose so that you can see at which dose those side effects occur, what those side effects are. And then you do post-market surveillance, where once the medication is released on the market, you have people report back which kind of side effects they have, so that we actually can learn, you know, the full realm of potential side effects once a drug is out on the market. So it's really important that we know those things so that we can help people figure out which medications are going to interact with other medications, which medications may worsen some of your comorbid or chronic medical conditions. And of course, you know, make sure that the medication that you're taking is good, so that you don't end up having side effects or toxins that you weren't intending on taking.
And what's more interesting, some of these supplements are not really needed, because I found that, for instance, the alpha liponic was actually available in vegetables such as broccoli, tomatoes, as an example. So if you're actually getting it naturally from foods, and you don't actually necessarily need the supplements, but then some people argue you're not getting enough from the foods itself. So there isn't a linear kind of explanation or system that works. A physician many years ago told me, for instance, if you have vitamin D deficiency, after the blood test, obviously, if it's quite low, you can actually just take supplements just to top up with it, but then come back, have blood tests again. If it comes back to normal, that means you don't really need to necessarily continue taking it, because then you could have an overdose on that.
Yeah, I mean, absolutely. There is a such thing as too many vitamins, hypervitaminosis, and things like vitamin A have even been shown to cause birth defects. But if we didn't do any research on vitamin A because it's natural, then we wouldn't have known that. And so it's really, really important, again, that we know what the maximum dose should be, and the purity of that substance. And that's where, you know, organizations like the USP are starting to come out that are doing that for supplements, but there's still a long way to go. And I think that, you know, again, I support holistic medical practitioners to an extent, but I think it's important that they're honest that, you know, there is some sort of active ingredient in the things that they're using, and that, you know, perhaps we don't have all of the evidence to know exactly what the side effects and purity of these substances are, because they're not regulated by the FDA. So, you know, I'm not necessarily anti-Eastern or holistic medicine, but I do find that I have a lot of patients who seek both. And I oftentimes will make sure that they understand that there are potential downsides to these unregulated medications.